Hi, Miss Alvarez. How are you doing today?
Hi, good. How are you?
Good. My name is Josh. I'm one of the pharmacists here. I just came here to go through your insulin that you're being discharged on. I understand the nurses went through how to administer and everything with you. Did you have any questions about that?
No, that was pretty clear. I had a lot of practice with that.
Okay, perfect. So the two insulins you're going to be discharged on is insulin glargine. It's also known as Basaglar. That's going to be 15 units at bedtime. And then insulin lispro Humalog, that's going to be 5 units before every meal, okay? And so it's important to remember that if you're not having a meal, you don't need to inject that insulin because it'll actually bring your sugars too low. Does that make sense?
Yes.
Okay. So it'll come in a box like this. It comes with 5 pens. Any pen you're not using, just store it in the refrigerator. Once you open a pen, you want to store it at room temperature. You don't put that one back in the fridge. You also want to make sure it's not in any direct sunlight, so not in a car or anything like that, and just away from heat. So a purse is a good spot, something like that, or on the counter. Any questions about that?
No.
Okay, perfect. So did the nurses go through kind of what to look out for as far as low blood sugar and high blood sugar?
No, not exactly.
Okay, so your goal range is going to be 80 to 130 when you're fasting, when you're not eating, and then your post-meal range would be less than 180. So high blood sugar would be above those ranges, low blood sugar would be below those ranges. So for hyperglycemia or high blood sugar, something you might expect would be extreme thirst, dry mouth, increased frequency in urination, blurred vision, weakness, or headache. And then low blood sugar increases in hunger, fast heart rate, sweating, trembling, anxiety, and dizziness. So if you take your blood sugar when you're feeling these signs of high blood sugar and it is high, you would want to call the doctor right away because we can provide you further guidance from there.
Okay.
For low blood sugar, if you take your blood sugar and it is low, we recommend having something sweet with a high sugar content, so that can be juice, soda, jelly beans, lollipops, anything like that, and then retake your sugars again in 15 minutes. And if they're still low, then you would want to call the doctor, okay?
Okay. And how often do I have to check my sugar?
So you want to check it at least 4 times a day. So that would be before each meal, and then right before bed you would want to check it again. And you can check it more often than that, but at least 4 times a day.
Okay.
All right?
Can you just explain to me again a little bit of the difference between the two insulins? I know there's 2 different ones.
Yeah, so insulin glargine or Basaglar is a longer acting one. That's why you're just injecting it 1 time at night, because that'll help keep your blood sugars low throughout the day. The other one, insulin lispro or Humalog, that is a rapid acting insulin, so it'll lower your blood sugars right after having meals from the sugars you're getting from your meals. Does that make sense?
Yes.
Okay, perfect. Do you mind just repeating back the information I've given you just so I can make sure you fully understand?
Sure. So I'm going to be on 2 different insulins for my diabetes. One is a long-acting, which I will do before bedtime, and then the 3 for each meal. I'm going to make sure that my sugar is not too low or too high. A low less than 70.
Less than 80.
Less than 80 is considered low, and I should call a doctor or take some sugar, eat something, drink juice or something to help bring it up. And if it's still low after 15 minutes, to call a doctor.
Mm-hmm.
Also, if it's too high, like I will experience maybe signs of thirst and going to the bathroom more often, blurry vision, I should call a doctor as well. In that case. And keep it in the fridge, away from the sun. I can keep it in my car.
I wouldn't keep it in your car, like in your purse or, on a counter where there's not a window nearby, something like that.
Okay.
All right? All right, if you have any other questions, feel free to call us, okay?
Okay.
It was a pleasure meeting you.
Thank you, you as well.